Live from the Scripps Studios, this is 10 News.
The hottest temperatures of the week sent a lot of people to cool off at our San Diego beaches. Good evening. I'm Steve Atkinson. That heat wave is not over yet and especially dangerous to San Diegans stuck inside with no air conditioners. Our meteorologist Angelica Campos joins us now with a look at those records we broke today and more coming tomorrow. Angelica.
Hi, Steve. That's right. Even if we get the same temperature in San Diego tomorrow of 85 degrees, that means we have a chance at breaking more records. And we did that today in Poway with 96 degrees, breaking the previous record of 92 degrees from 2004. We tied records in Carlsbad and Campo. In Campo, we made it to 95 degrees. We had similar temperatures in El Cajon, Alpine, and also in Escondido. And some of the places that could potentially break records tomorrow include San Diego, places like Alpine and even Chula Vista, Oceanside. The record for tomorrow is 88 degrees. I don't think it's going to get that hot, but tonight we still have some 70s out there. 75 degrees right now in Fallbrook. It is 65 degrees in Poway, so it's starting to look a little bit better. But in San Diego, it is currently 70 degrees, Steve. That is the average daytime high for this time of the year.
And it's 11 o'clock at night. All right, Angelica, thank you. All right, here's a look at the latest coronavirus numbers in our county. 159 new cases were reported today. That brings our total to 4,319. The county also announced 8 additional deaths. That total is now 158. San Diegans have been under stay-at-home orders for almost 2 months now. Families who don't live with their elderly parents or grandparents have not been able to visit each other. As my co-anchor Kimberly Hunt found out today, the plan for eventually seeing those grandparents, that is far from clear. Kim.
Steve, families are separated for a good reason. We simply cannot risk infecting our elderly loved ones. And as we look forward, we have Mother's Day, then there's Father's Day, 4th of July, Christmas. We wanted to know eventually how we will reunite with our families. And we took that question to the county today. What we found is the answer is complicated. And like so many things with COVID-19, it's not entirely ready to be answered just yet.
At this point, people would like to visit, but they can't be sure without a test that they're not positive. What are your guidelines for reunification? What does that look like?
We are asking all elderly individuals to, if they do not already live with their family members, for them to stay sequestered, social distancing.
How do you visit grandma or grandpa without a test?
Because you do not want to introduce someone who's potentially infected, because now we also know that individuals can be asymptomatic or pre-symptomatic and still have the virus. So we will continue to recommend that our vulnerable populations, like individuals 65 years of age and older, stay at home.
So my initial question to you was reunification.
In the future, once our serology task force or work group that is part of our laboratory testing task force define the actions that our community will take going forward until a vaccine can be determined.
And my time was up.
If you want to call back in later, we can go ahead and try to work in.
Yeah, it's for the reunification eventually. That is the question.
We'll have to get back to you on that one.
But they never got back to me, and texted questions began.
This is also about reunification. Now, prior to a vaccine, how will you eventually be able to reunify with a parent? Will you be tested first, or what will the process look like?
We don't know the process of how we will use serology, and that example would best probably be utilized with serology testing. We have a work group that's working out that overall strategy. So for the questions about reunification, I cannot give you a specific answer at this time.
Yes, that was me. It seems families will have to wait until herd immunity or antibody testing makes it safe to reunify with our elderly loved ones. And Dr. Wooden said that the task force is looking at this, specifically its antibody testing. That would suggest that they are thinking there is a pathway with antibody testing to reunification, but when we would have the capacity or how that would work is still unknown. Steve.
And a large number for herd immunity. All right, Kim, thank you. In the meantime, San Diego Mayor Kevin Faulconer says this is no time to leave our seniors or their caregivers behind. Today, he encouraged those in need to sign up for the city's Social Calls program.
It's operated by our city's Park and Recreation Department, and it offers comfort and it offers conversation to all seniors.
Caregivers are the invisible heroes. However, they are at times treated like a disposable workforce despite their essential work.
The union for those frontline caregivers says they are now requesting more personal protective equipment from the county and the state.
Both of those agencies are responsible for the death of this man.
Immigrant rights groups are reacting to the first COVID-19 death of a detainee at the Otay Mesa Detention Center. That detainee was originally from El Salvador. Our 10 News reporter Laura Acevedo tells us why these groups are once again asking for immigrants to be released.
We know the man had been hospitalized since the end of April. He died this morning in a hospital. The COVID-19 outbreak at the Otay Mesa Detention Center has been on the minds of immigrant activists for weeks.
This was preventable death. It did not have to come to this.
Pedro Rios is with the American Friends Service Committee, just one of the groups asking for the release of detainees at the facility, saying they don't have proper facial coverings or ways to practice social distancing.
It's not a facility that has in as a priority the basic human welfare of those it detains, and for that reason, people should be released.
The detainee that died hasn't been identified pending family notification. Rios says the man was 57 years old, from El Salvador, and had a relative in Los Angeles. He says ICE and CoreCivic, the contractor that runs the facility, had the power to improve conditions inside.
Both of those agencies are responsible for the death of this man.
The ACLU also reacted to the detainee's death today, saying in part, unless ICE acts quickly to release far more people from detention, they will keep getting sick and many more will die. A statement Rios agrees with.
If nothing is done, I think that this facility, the Otay Mesa Detention Center, essentially becomes a petri dish for COVID-19.
We did reach out to ICE and CoreCivic for a comment. We did not hear back from CoreCivic. ICE told us they cannot comment until family is notified. Laura Acevedo, 10 News.
Thousands of people in California are now being trained on contact tracing to slow the spread of COVID-19. UC San Francisco and UCLA, they are working together with health departments all across the state. The goal is to build an army of 20,000 people to backtrack the steps of every newly infected person and then reach out to every person potentially exposed. Training is on the fast track. It takes about 20 hours over the course of 5 days. More than 73,000 people in this country have now died from the coronavirus. As ABC's Marcy Gonzalez reports, as states continue to reopen, the virus is now surging in rural America.
The number of COVID-19 cases rising in at least 19 states, with hotspots now popping up in rural parts of the country, according to FEMA. The highest infection rate in the country now in Tennessee, where cases in the state's largest prison soared from 27 to more than 1,300 in just 10 days. In Illinois, the largest one-day death toll since the pandemic began, recorded just this week. And in Texas, one of 38 states that have now eased restrictions, allowing some businesses to reopen, 1,000 new cases recorded in one day. Other business owners there still waiting for the green light, frustrated. This bar owner arrested for opening early.
I will lose my business. My bartenders are already starving to death. I see my bar owner friends can't even pay for their medical medicines. This is terrible.
A small public school in Montana set to be one of the first in the nation to reopen Thursday, putting precautions in place as they open their doors to students for 16 days before summer break begins.
We have the space but we also have very small numbers, and that's the only reason we can open it.
The virus also having an impact on the nation's meat supply and access to food. One study finding 9 million children under the age of 12 in this country now suffer from food insecurity. As scientists now study mutations in the virus that causes COVID-19 and new human trials begin for potential vaccines, President Trump reversing course on plans to disband the coronavirus task force in the coming weeks.
So we'll be leaving the task force indefinitely.
Marcy Gonzalez, ABC News, Los Angeles.